Bringing you the flavor of the Midlands. Live from Columbia, this is Soda City Live.
Welcome back to Soda City Live, everyone. Our next segment, we are sharing tips for transitioning your loved ones back home after being hospitalized. Maybe they were in rehab, and we have tips on how Medicare can assist you. Joining us today is Synergy Home Care gerontologist, Dr. Macie Smith, and former state senator and owner of Lori Life and Health, Joel Lori. Thank you so much for coming to the show.
Thank you for having us.
Yes, Dr. Smith, you always bring such great tips, and I know that Joel, it's all going together, right? You're going to share some great tips as well today. This is really a topic that doesn't get discussed much. So when you're transitioning your older loved ones from being hospitalized back to their home, what are some tips that you need to know to make sure this is a smooth transition?
So first of all, sometimes it can happen overnight. So tools and tips are very important for a successful transition, because we don't want them re-hospitalized for the same situation.
Right.
And so one of the things you want to be sure, and this is family members, but also the person who's hospitalized, make sure you have the list of all the medications they had coming in while they were there and when they're discharged. Need to be a part of the discharge planning meeting. Many times patients are discharged without notification. The family members aren't notified in enough time, but there should always be a discharge planning meeting. The family and the patient should also ask about any medical equipment that's needed or home modifications. So again, a successful transition, but also to referrals to home health and home care. Could possibly talk about transportation and even Meals on Wheels. And some of these support services could be covered by Medicare, right, Joel?
Yeah.
Well, that's exactly right. And Dr. Smith does such a great job. I've had the chance to work with her and hear her speak, and she's just such a great advocate for families. But it's real important, Billie Jean, for a client or a patient to understand their coverage and what may be covered, because there are some things that Medicare pays for, and there's some things that Medicare doesn't pay for. For example, Medicare may pay for home health if it's prescribed by a doctor. If you need things like durable medical equipment, rehabilitative care, such as physical therapy, things like that. They won't pay for custodial care. But then we got to go a little bit deeper and see what kind of coverage they have, because today Medicare Advantage plans will provide extra benefits. Dr. Smith mentioned meals. We work a lot with Blue Cross here in Columbia. They may provide meals. They may provide a nurse to come into your home periodically to check up on you. So there are lots of things that can come that may not be covered by original Medicare, but it's really understanding your benefits and talking to a local expert that can help you navigate through that.
And speaking of understanding benefits, I believe that people get Medicare and Medicaid confused. Can you tell us the difference?
I would love to tell you the difference, because there's a lot happening in South Carolina with Medicaid that we probably need to talk about some other time. Medicare is the program that is basically the federal government program that once you turn 65, you qualify for, and it takes over your health insurance. You can qualify at a younger age if you have been on disability for 24 months or have something like Lou Gehrig's disease or end-stage renal failure. That's Medicare, okay? Your hospitalization is your Part A, your medical is your Part B, and most people get Part A at 0 premium as a result of paying into Social Security. Part B has a premium, and then that's where an agency like ours comes in to look at a Medicare Advantage or a Medicare supplement plan, etc. Medicaid is a completely different program. In South Carolina, Medicaid covers a large percentage of children that are born into lower income families, some people on disabilities, or even seniors that may be very low income, and the last group are low income moms who are pregnant, okay? And in that case, Medicaid comes through the federal government to the state government, and usually it's about a 75 to 25 match. The federal government pays 75 cents, the state government pays 25 cents. There are some people that could be on both. They're called duals, D-U-A-L-S, because they're on Medicare and Medicaid. Typically that's going to be someone that is a lower income senior who qualifies for some of the Medicaid programs.
Okay, thank you so much for explaining that, because I feel like people get that confused all the time.
Well, I hope I didn't make it worse.
No, you did a great job doing that. But the big takeaway that I'm getting from both of you when it comes to that smooth transition, ask questions.
Yeah.
Be vocal.
And I'll tell you too, Synergy Home Care has a hospital to home discharge planning document that I helped to create that gives family members the information about the difference between home health and home care, what those tips are, what questions to ask, and a place to document it in a plan, because that's the information they would want to share with other family members, other physicians, and maybe an insurance carrier. It helps to build that comprehensive care plan.
Okay, great. Before we wrap up, any other tips that you would like to share with our viewers? I'll start with you, Dr.
You know, the biggest thing is to be a part of that care plan. You know, don't be offended by the white coat. You own your health care. You know more about you than any doctor does, so you want to ask questions. If the doctor calls and tells you to pick up your loved one from the hospital and you are not prepared, don't take them home. Ask for a meeting. You can ask for a discharge planning meeting at any time, because basically you want to get enough information to support a healthy, safe transition.
Okay.
Perfect. And the two tips I would give is, number one, deal with somebody you know and trust. Dr. Smith and I were talking about this earlier. We see a lot of call centers today. You know, a lot of call centers advertising this or that for Medicare. And in our office, we clean up a lot of those messes. So deal with somebody that specializes in Medicare when it comes to looking at your coverage, that really understands this space, not somebody who might do car and auto and home and Medicare. You know, deal with somebody who specializes in Medicare. The other tip I could give you is watch Soda City Live. My wife just loves Billie Jean and Donnie, okay? She loves y'all.
Tell Mrs. Lori we appreciate her
Yes,
watching.
ma'am.
Thank you so much. Hi, Mrs. Lori. Thank you. And before we go to, tell people how they can stay in contact with you.
Well, definitely can email me at info@dtconsultant.org.
Or you can dial us locally, 803-256-2067, or go to LoriLifeandHealth.com.
All right, Joel, Lori, and Dr. Smith coming on. We appreciate it, and we look forward to seeing you back here next month with some great tips. We're going to take a quick break. Much more Soda City Live after this. A hint, get y'all dancing shoes out, because Motown is coming to the Midlands.